Hi everyone, this is Dr.Shama Mohan, Oral and Maxillofacial Surgeon, working in Nano Hospitals, Holimau. So the treatment is based on the kind of injury the patient sustains. We come across a lot of pediatric patients in this hospital who come with cut lacerations and we manage them accordingly. They are looking forward to a very meticulous and plastic suturing which leaves them with very minimal scarring in the future. And when we come across patients with fractures, so if it is a child patient, if it's a pediatric patient with a fracture, then we go ahead with resolvable plates and screws, which is a good option for them. We also come across fractures that do not need any treatment. And then there are fractures which need something called closed reduction. That is, we do not open up or place any plates or screws, but we just fix them with manual manipulation and give them some splints. Then you have extensive fractures like facial fractures all over the face. Here we'll have to open up and we'll have to give them plates and screws which are called as mini plates. So these small screws and plates are used to fix the bone in their original position to avoid any further complications in the future.